Hello again, Dr. Kirk back. Today we're going to talk about one of the things that probably most women choose to avoid. In fact, I heard a comment made that 1 week during the year is probably the woman's worst week, and that's the week that she visits both the dentist and the gynecologist for her annual exams. I like to think that we do a much better job at St. Helena Women's Health Center. We're very compassionate, and we want to think of you as part of our family. And we're not interested in causing our family members any pain, but it's not a pleasant experience to have a pap smear. The good news on pap smears, though, I want to share with you because it just came out this year. Now, with a normal pap history, if you haven't had abnormal paps, and we'll talk about that, a normal pap history means that you can have a pap smear from the age of 21, we don't do them before 21 anymore, to the age of 65, and we don't do them after 65 anymore. And believe it or not, you can do them every 3 years instead of the every year pain and suffering that you had to go through before. Doesn't mean you shouldn't see your doctor every year, because there are many other things that are important in that visit, particularly breast exams as we get into the 30s and 40s and 50s, and particularly examining inside if there's any symptoms. Also just checking and making sure that everything has been done to verify that you are healthy. That's what we do at these annual gynecologic exams. That being said, the good news of a pap smear every 3 years probably relieves some of you, but it's still a pap smear every 3 years. Well, what is the reason that we do the pap smear? Oh, another aside. You can actually go to 5 years in the studies that have been presented and the groups that sort of police or supervise what we do as gynecologists. You can go to 5 years if you have a normal pap smear and a human papillomavirus test that's negative. And that's why we do pap smears. Pap smear is to find whether or not you have an infection with human papillomavirus. What is a human papillomavirus? Well, it's human, it affects humans. The papillomavirus is extremely common. It affects all animals, all mammals that I'm aware of. But of course, human papillomavirus doesn't affect any other animals. The other papillomaviruses, there's rhinoceros papillomavirus, etc., etc. But in humans, there are probably more than 100 different subtypes of HPV or human papillomavirus that we are knowledgeable about. The good news is that most of those don't really cause much grief. They do cause warts. So warts are the counterpart of human papillomavirus. But it's not the bad part of human papillomavirus. The bad part is that it causes cancer in many people. It's what we call high-risk human papillomavirus. There's about 14 or 15 of those that we're aware of out of that 100. And we know which ones they are. So we actually look for those specific human papillomavirus cells that have been infected. We look for the DNA, because they're DNA just like we are. They have DNA, the human papillomavirus. We look for that in the pap smear on the cells that we've submitted for the pap test. And if you don't have high-risk human papillomavirus, your risk of getting cervical cancer is almost zero. Never say never, but it's almost zero. And that's why you can go, if you have no papillomavirus of the high-risk subtype, you can go for up to 5 years in between your paps nowadays, and we think it's very, very safe. Well, why is that? Well, cervical cancer, which is what is caused by these high-risk human papillomaviruses, it doesn't grow very fast, with one exception, adenocarcinoma. And we'll talk about adenocarcinoma in another moment. But at the end of the day, human papillomavirus takes probably 10 to 15 years to actually develop into cancer. So if we're checking you every 3 years or 5 years, it's unlikely we're actually going to miss it. That's the key piece. That being said, there's one thing that every woman, and frankly every man, should do, and they should do it when they're girls and boys. What is that? Receive the vaccination. Human papillomavirus is a virus, and like many other viruses, we can actually prevent you from getting the infection by giving you a vaccine. Well, there's a lot of controversy around the human papillomavirus vaccine. There are 2 different ones on the market, Cervarix and Gardasil. Gardasil is the more commonly used. It covers 4 of those subtype HPV viruses, 2 of the high-risk ones, 16 and 18, and those are responsible for 70% of all cancer that affects the cervix. And it blocks it extremely effectively, to the point where women who use, and men, in terms of transmitting this infection, because this is, as you know, and if you don't, you're hearing it here, a sexually transmitted disease. Human papillomavirus is a sexually transmitted disease, plain and simple. That's why it's so common, because we do have sex frequently. In fact, by the age of 22, a woman who's finished college, on average, about 55 to 60% of those women have actually been infected with the human papillomavirus. Good news, most women clear it by themselves. But if you had the vaccine, at least 70% of the time, you would have cancer risks blocked by getting the vaccine, which is 3 doses. First dose, second dose 2 months later, third dose 6 months after the first. If you don't get them right on time, it doesn't matter. Go in and get it whenever you're willing and able, and remember, if you've only had 2, go and get the next one. Even a year later, it's still okay and it makes sense. At the end of the day, it doesn't make you want to have sex. It doesn't make your daughters want to have sex. It has nothing to do with that. It simply protects from the infection of human papillomavirus 70% of the time, with reduction of 70% in cancer and 90% in warts, as it affects 2 of the primary wart-causing human papillomaviruses. Great information today. I hope you take it seriously. Come in, make your appointment. Get your daughters vaccinated, and if you're 26 years or younger and you're listening, get yourselves vaccinated, because that's the cutoff right now. Even though we think it probably still has value, it hasn't yet been approved for over the age of 26. Even if you started sex, it doesn't matter. It still protects you, because the likelihood of you having all 4 of those is very small. Even if you've had an abnormal pap smear in the past, caused by one of those. Not that you'd necessarily know that, but even if you had, it's unlikely you've had the other 3, and it'll still protect you from those other 3. So think about it clearly, and ask us any questions. Call anytime and come and see us. We look forward to seeing you. Thanks for listening to us. Take care and have a blessed day.